Join me in our national anthem and pledge the flag, please. Pledge allegiance to the flag of the United States of America and to the republic which stands one nation under God, indivisible, with liberty and justice for all. Mr. Shealy, invocation, please.
Let us pray. Father, we thank you for this Rotary Club and the men and women who practice the motto of service above self. We ask that you bless this food and the nourishment of our bodies and us to your service. We ask in Christ's name. Amen.
Amen. Mr. Brad, come on down. Coming in for Mr. Terry today, family of works.
Okay, good afternoon. We have one birthday celebrating this week. That is Mr. Doug Blankenship, March 6th. And we have a couple of anniversaries coming up. We have Mr. John Brown and his wife Karen on March the 6th. And we have Catherine Harrison and Samuel on March the 9th. Let's give these folks a big round of applause.
And Caitlin, no, we don't have any guests, do we, today? Okay. Valerie Russell, come on down. Can't ask it.
Check all your.
I haven't taken shirt off. Brother said cheese. $441 today. 0740 is the last four. 0740. Here it is.
0740.
0740.
Gonna have to draw again.
All right, going once, going twice, gone.
You gave up too quick. We did.
0749. Ding, 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 ding. And diamond. So the points roll on. Thank y'all. Greg Hendricks and Alan Richards have a couple of announcements.
Go ahead. No, I'll go first.
We have coming up the third annual or 23rd or something like that, annual Rotary Ball. This year, it is going by a different name. It still supports the Rotary Miracle Field, but it is a themed ball, not black tie, Derby after dark, May the 3rd. And if you come for the happy hour, you can watch the Kentucky Derby being run at 5:57. Anyway, information on the tables. You can purchase individual tickets, tables. It goes through all the different options there. Thank you very much.
Thank you, Rick. Just following up on the Derby After Dark. This is a joint effort between the Monday Rotary Club and the Tuesday Rotary Club. We had a joint meeting last week. I just wanted to recap one of the items that was brought up. We're going to have a kickoff next Tuesday, 3/11. Tuesday Club will be hosting a kickoff at the Miracle Field. It'll be an off-site meeting for them, box lunch, individual pays, and really hope to have reach out to the media and have that brought in to help promote the event. Because if you don't know, I want you to think about it as far as when we gather sponsors and we all purchase our individual tickets. This is in support of the Miracle Field. This is the reason we're having it all. If you've not been to the Miracle Field or been to the playground, and I suggest to do so, there are some repairs that need to be made, not only the maintenance, but there's a good bit of upkeep needs to be made. So I encourage you, I know I'll do all I can to attend next Tuesday, support this kickoff. Next Tuesday, noon meeting for the Rotary Ball Kickoff Miracle Field fundraiser. Thank you.
If I can, Mr. Sorrells, Tom, can you come up front? Yes, sir, you're the man. And Miss Dale Goodwin. I'm interrupting your lunch, I know.
Go ahead.
The presentation of a Paul Harris Fellow is a Rotary Foundation's way of expressing its appreciation for a substantial contribution to his humanitarian and educational program. This honor is named for Rotary's founder Paul Harris, who started in 1905. Dale and Tom, it is because of gifts like yours that Rotary Foundation is able to carry out an array of programs that achieve beneficial changes in our world. We congratulate you and we thank you for your commitment to the programs of the Rotary Foundation. I'd like to invite everyone to rise and join me in recognizing Dale Goodwin and Tom Sorrells, the recipients of the Paul Harris Fellow. Dale is a +8 and Tom is a +1.
You look closer.
That's right. Got to arrange this thing.
Thank you.
Thank you.
Thank you.
Well, I felt bad last week. I know you already hear John do his intro, but I said War Eagle, and I told my wife about it. She's a big Auburn fan, but roll tide for the. I should have said roll tide. I said it's definitely because our fingers of East from Tuscaloosa, and he's a big Bama fan, so scratch everything off. John.
Thank you, President Rick. We have the CEO of Five Horizons Health Services speaking with us today, Dr. Kirkpatrick. Just like to give a few opening comments of his bio here before he comes and speaks with us. He is a native of North Carolina and has lived in Tuscaloosa since 1995. He has since earned 3 degrees from the University of Alabama, 1 a Bachelor of Science in Psychology, a Master's in Counseling, and the 3rd a PhD in Management Public Administration. His early career includes serving children with emotional and behavioral disorders within school systems at Brewer Porch Children's Center. Since 2007, he has served as the Executive Director and subsequently the Chief Executive Officer of Five Horizons Health Services, which was formerly West Alabama AIDS Outreach. His efforts at Five Horizons have been to expand the provision of medical care, social services, education and outreach, advocacy, and research related to HIV to a 53-county area, East Central Mississippi, and the entirety of the Alabama Black Belt. Dr. Kirkpatrick also served as an adjunct professor specializing in non-for-profit administration at the University of Alabama. He and his wife, Monica, have 4 children. Help me in welcoming Dr. Kirkpatrick.
Did I lose you all when you realized I was? So yes, I'm Billy Kirkpatrick, Five Horizons Health Services from Tuscaloosa. I want to introduce our Chief Executive Roberts back here with me. I also was a longtime Rotarian in Tuscaloosa Youth Club. The only reason I'm not still a Rotarian is because the work demands, as we'll talk about, got so excessive I had to really cut out. But I love Rotary, I love everything it stands for, and I'm very, very thankful to be here at this group today. And our handouts, you have some on your table. They're not going to match everything I say because as of the last 2 weeks, they're outdated, but I'll explain that. Okay. So I'm going to tell you a little bit about our agency. The mission of our agency is to promote a healthy, compassionate, and educated community through medical care, prevention, education, supportive services, research, and advocacy. So our agency was originally founded in 1988. It's great, how do I say this? It's great to speak to a group of maturity because when I speak to college campuses, they do not, those kids weren't even born in the 90s, they're born in the 80s. So those of you who are alive in the 80s knew that AIDS was absolutely a death sentence. You were diagnosed with it in the 80s. Okay. So I'm very proud of what our founders accomplished. They started this little agency in Tuscaloosa, and basically all you could do was help people die with dignity and then provide some prevention education. So at that point, when it was started, there were only 2 people working there. We served 10 counties, so Tuscaloosa County, and then the 9 surrounding rural counties. So for many years, we did social services, which I'll talk about. But around the early 90s, around the time that Magic Johnson drew HIV, the medications took a quantum leap. So it went from a death sentence to a chronic disease. And what that meant for us, and the theme of everything I'm going to talk about here is the intersection. What that meant was there's now an ever-aging, ever-growing population of those with HIV, and a huge percentage of those live in poverty. And then in addition to that, a huge percentage live in rural areas, which provides its own challenges. So from 1988 to 2018, we provided social services for those folks, and we did a lot of education. There came a point where we said we do all the prevention education that we can do, and yet no one in West Alabama was providing PrEP, which is pre-exposure prophylaxis. So individuals that are at high risk for contracting HIV, we now have a medication that's available that would prevent them from contracting. Now, here's what I want to say about that. We are providing a public health service. So we want to make sure that our folks that live with HIV are in care and they stay in care because we can get them to a point where they're undetected. When they're undetectable, there is a 0% chance that they spread HIV to anyone else. So we love our clients, but we're also providing our services for others. And so if we can keep our folks in care that live with HIV, that's great for everyone. If we can prevent infections, that is great for everyone. And so when we started this PrEP clinic, and again, we started it with no experience and no funding to do it. It was just simply the right thing to do. So we start this clinic, we start getting folks in. Well, now, for the first time, you're having to recruit. Because prior, the only folks that we serve were those that live with HIV and those in poverty. And we have a lot of state and federal programs that dictate the folks that use our services have to be a certain percentage of poverty. That's not something you're putting on a billboard. We're not actually recruiting those folks because they're referred to us. But now that we're trying to get folks into care prior to them contracting HIV, we now have to recruit them. And we could not do that as the West Alabama AIDS Outreach. There was just too much stigma attached. So in 2018, we rebranded, we became Five Horizons Health Services. Any Pearl Jam fans in here? Anybody? Okay, thank you. Because again, these students in University of Alabama, they don't even know what Pearl Jam is anymore. Pearl Jam has a song called Black, and in that song says all five horizons revolve around your soul. And that's where the five came from. So we wanted something catchy, memorable, but also something that would let people know what services we provide and offer that next. So we did that in 2018. 2 years later, we realized that we were serving, say, Walker County down to Perry County. That was our service area. You go right across the border to East Central Mississippi. And same HIV rates, same poverty rates, nothing there to serve those folks. And so this was not the plan, but right in the middle of COVID, we started a clinic there. So the same things we do in Tuscaloosa, clinic, transportation, food bank, all these things. And so that was 2020. And then the part of our history that really, really aged me was 2.5 years ago. So we had a sister agency called Medical Advocacy and Outreach that served all the way from Selma to Dothan. And they basically went bankrupt. They served thousands and thousands of HIV patients, and we could not let the doors close. And so we assumed responsibility for those services. So we did not organically come to Dothan. Dothan was part of the service area of MAO, Medical Advocacy and Outreach. So we've been here about 2.5 years. We have an amazing center. And then the reason I said that your handouts are not completely up to date is because in Mississippi 2 weeks ago, we got approval from the Mississippi State Department of Health to expand to Oxford and Meridian. So we now serve 68 counties instead of the 53 on here. This is the newest part of our history, is expansion to Oxford and Meridian. So the 5 is not arbitrary. It stands for our 5 pillars of care. So number 1 is medical care. So for HIV, for PrEP, for STI testing and treatment. Our team does prevention, education, and outreach. They are the most innovative team in the history of mankind. We make sure that we're serving individuals with challenges, right? Not just challenges in life, but challenges getting into care. And so what we're not ever going to be is a sterile document box where we have a brick and mortar clinic and we hang a shingle and we expect people with challenges to come to us. To the extent possible, we're going to take services to the folks that need it, right? We're going to be making sure we break down all those barriers. Part of what this team does so unbelievably well is build relationships. Everything is based on relationships. The things that we do medically, people don't generally want to talk about. It's embarrassing to come to a place and talk about these things. And it's certainly not something that we want to have a general conversation with somebody in public. But when we're meeting with these students on college campuses and in the community, our folks are so skilled at building those relationships. You know how you have a relationship with someone, you can say things that you couldn't say otherwise. So if someone really needs to get tested, if someone really needs to be in care, if someone needs to get back into care, if you built that relationship, you can do that. And that's what our team does really well. So supportive services, and this is what we've done for 30 plus years now. One, that's social services for individuals that live with HIV, but they're also in poverty. So any challenge that we can meet to make sure that our HIV patients stay in care, we're going to do. So we're going to make sure that they have financial assistance. We're going to make sure that they have affordable housing. We're gonna make sure they have transportation. We're gonna make sure they have food. We're gonna make sure they have insurance. We're gonna do everything we can so that they stay in care. And the other part of supportive services is something that we're currently working on. We're gonna provide behavioral health services, not only to our patients, but to the general community. Research, this is very near and dear to my heart. This is us linking with academic institutions, to develop innovative programs, folks that need it, and to get the funding for that. And then advocacy, which takes two routes. One is us working in DC, Montgomery, Jackson, Mississippi, to make sure we have the funding we need for our services. The other piece of that is that really abstract notion of stigma reduction in local community. And so when I started doing this job 17 and a half years ago, I do a lot of public speaking. I thought it's going to change people. And changing people know more stats than them. The only real way to alleviate stigma is to create dialogue between our clients and the community. And that's a beautiful sentence, but it's much more difficult than that because our clients have had breaches of confidentiality. They've had parents that treat them poorly because they live with HIV. They've had people that make them use different silverware. They've had all these issues. So if I'm asking our HIV patients to basically disclose their status to the community, that's a scary thing, and it takes a brave group of folks to do that. And in Tuscaloosa, we have, at this point, 8 folks that do this. And so they are the best representatives for what we do. So once a month, we have these, and I'll talk about it. We have those young groups, it's AJA and I, it's African word, PUA is the start. And in those groups, student group, church group, civic group, they may just come in once a month. They can sponsor the food for clients and themselves, and they just sit with our clients and fellowship with them and love on them. And it's beautiful. And it sounds really, really really simple, but it's very profound. Now, back in the day, we used to do this group when we do bingo, but they got too stressful because we had clients that just be sweating and stressing out. We're just gonna talk. But if you have a group that comes in and they do have some stigma, which is what we want, frankly, and they sit there with our clients and they go, well, I'm not magically contracting HIV. And I wouldn't know these people were positive if I passed them in the grocery store. And these folks are amazing people. That's when the stigma starts to roll. And so that's the other piece of advocacy for us. So by the numbers, remember I said we had 2 employees in 1988, we had 6 employees in 2007, and now we have 200 employees. So I was not nearly this great 2.5 years ago, but here we are. Between our HIV and PrEP patients, we serve about 4,000 people total. We reach about 30,000 people per year with our prevention outreach. And this slide is updated, so now we serve 68 counties in Alabama and Mississippi. So this is just our service area. So you can imagine administering and spread out. So it's not like you have 200 folks in one area and 200 folks spread out. Basically, from Dothan to Oxford, Mississippi is about 6 hours. So we have a pretty large geographic footprint. So the need in Alabama, we have about 18,000 people living with HIV. We have well over 200 folks just in the first 6 months of last year that were newly diagnosed with HIV. We have 83% of people that have received new diagnosis. And then I'm gonna skip some of this because it gets a little complex, but if you see that last number, that 59%, this is really what we're going for. We want, when I said undetectable earlier, we want our folks to be virally suppressed. And that's what that is. When they're virally suppressed, we know that they're healthy and the general community is safe from this. So this is why we provide all the services that we provide. And you see, as a state, these aren't Five Horizons numbers, these are as a state. We have to do a much better job getting folks virally suppressed. So getting them tested, making sure they know their status, getting them in care, and keeping them in care. So issues at the forefront. Science has given us the tools to stop transmissions. We absolutely can. The way to do that is testing, right? So everyone should get tested at least once. What we push for is opt-out testing, say in hospitals. Unless you ask not to be tested for it, we want people to get tested in the hospitals. We love it at general care clinics as well. The ART is the antiretroviral therapy. It's fantastic. So You know, I mentioned in the early nineties, the medication took a quantum leap. But even in the nineties, you might take a cotton, you might take 17 different pills with pretty horrific side effects. You could live, but it was rough. Now it might be one pill or two pills with minimal side effects. So medications have come a long way. And then U equals U, this is what I've been talking about. It's undetectable equals untransmittable. And I've talked about PrEP, so it's a once a day medication for individuals at high risk. We also have PEP, which is amazing. So that's post-exposure prophylaxis, which means this. We link with a sexual assault center in Tuscaloosa, it's called Tuscaloosa Safe Center. When someone is a victim of sexual assault, they can come to us and we get them on PEP. So that, and they take that for a month, which eradicates the chances of them contracting HIV from a person that's sexually assaulted them. So they've got a lot of other things on their head. That we love to take off their head. We love PEP very much. So more issues at the forefront. So everything that we do, as I mentioned, about social determinants, we're going to make sure that we're addressing housing, transportation. Again, I keep talking about poverty. I want you to also think about the intersection of rurality, right? So you might have challenges in an urban area. You have many more challenges in a rural area. So housing is a problem, transportation, getting to and from medical care, or social services, or behavioral health, nutrition, lack of education, access to healthcare, employment, all those things. Those are what we're working toward every single day. So HIV stigma, there still seems to be a lot of myths around HIV, but I will say this, the average life expectancy of someone diagnosed with HIV today is more than 70. That's impressive. So how can you support what we do? Help us break down the stigma in the community, help encourage individuals to get tested. We can get everyone tested, those that are reactive, those that react positive for HIV, get them in care, get them on HIV. If they are not positive, but they're high risk, get them on PrEP. We can end this epidemic with your help. Another way is advocacy. If there's ever a way that you want to work with us, to advocate on a state or national level, please contact us. We'd be glad to have you join us. So specifically, here's a few ways to get involved. When we took over for MAO, we basically did away with our historic board and started a brand new board. Here's why. We have all these different locations, and we didn't want everything centered on Tuscaloosa. And so we now have a board of directors that has representatives from each area, including Dothan. We now do fundraisers in each area, including Dothan, because we want each area to know how valued they are. We want to put the same amount of work and support into each area that we do in Tuscaloosa. So one, when we did that, so now our board historically really helped us with our fundraiser in Tuscaloosa. Now our board strictly has fiduciary responsibility on youth business. So now in each location, we have what's called the 5H Foundation. So there are no board responsibilities at all. And so this group, and we look, I'm sure a lot of you are involved in nonprofits. You know what nonprofits are all doing? They're all trying to recruit youth. They're all trying to recruit these high caliber board members or volunteers who are already extremely busy. So we knew that we have to develop something that is really user-friendly and really time-friendly. And so that's what this foundation is. We're not on the board. We have one donor fundraiser each year. You would help us to sell some tickets. We are not really trying to make money off this fundraiser, although we like to pull money from it. It's really as much about who we are as it's about making money. And so we have a group of folks, a diverse group of folks that can bring in their various support circles, and they hear at this fundraiser about what we do. They're much more apt to be supportive of it. And so if you can sell a few reasonably priced tickets and keep the ticket prices low so that everyone can be a part of this, you secure a few raffle items, you come help work the event, that is it. So if anyone here wants to be involved in the 5H Foundation, please let us know. And then as I mentioned, Ajani groups. We have groups that just do it once. We have groups that come back a few times a year. But get in contact with us if you would like to come, just sit down. You can do it individually, you can do it as a group, you can bring your church, you can bring some students, however you want to do it. Bring a group and just eat with and fellowship with some of our patients. And by the way, I mentioned the impact on those that come do it. It's also very impactful for our patients because they do stay in their very protective social circle. And month after month, when they see other groups come in there and love on them, knowing they live with HIV, it is very, very healing. So if you have any interest at all in doing that, please contact us. Thank you so much. Any questions?
In your service area, there are a lot of colleges and universities in both states.
Mhm.
You have entrance into those campuses?
We do. That's such a great question. So one, we want the highest risk folks in the state are college students, right? Really, statistically 14 to 25, okay? So we wouldn't be doing our job if we weren't trying to reach those kids. There's a lot of college campuses in our service area that don't have on-campus healthcare. There are a lot of college campuses that have half their students don't have insurance. And so in Tuscaloosa, we have an HBCU called Stillman College. And a lot of what we do came from our work, our very innovative work with that school. So, like I said, they don't have on-campus healthcare. A lot of those students don't have health insurance, and they statistically are the highest risk students in the state, right? So again, we can't just hang our shingle and expect those students to come to us. And again, like if you live with HIV, you're more apt to stay in care. But if you are high risk and you need to be on PrEP, like you're not always going to do that. Sometimes you have relationships. So there was a while that we had one room at Stillman, and we had a person there full time, and he would provide STI tests, and as part of that, they're free. Part of that would be HIV. So as you're there on campus, you're making it accessible, you build those relationships, and that person can't just become like the STI guy, right? So you have to build relationships. He ends up being like the ad hoc counselor. He's helping them with relationships. He's referring them to food bank. He's doing everything to build that relationship. So then he has their ear and their trust when they need to get tested and get care. What we had was a bunch of students in Tuscaloosa that were carpool to Birmingham to get affordable STI testing and treatment because it wasn't affordable in Tuscaloosa. And so we would offer free STI testing. And then, I mean, what if we offer you free tests and you have syphilis? And then it's like, well, okay, but then you have to go to a doc in the box for $150 you don't have. Like that would be unethical for me to test you in the first place. And so for those students, we made sure that not only were we going to test them for free, but treatment was either going to be free or incredibly reduced, right? So what we do is we put people on those campuses full time. And then eventually at Stillman, we bought a barber shop across the street, renovated it, and has become like a community home for those students. And the real power in what we do is we have different names for them, as peer educators, campus ambassadors. As cool as I might think I am, I'm like singing balls to students, right? You know who they listen to? Each other. And so we have really, really incredible students on those campuses that are employed by us part-time that spread our message, educate, get people tested, get them in care, get them back in care if they've gotten out. It's really, really innovative work. And I just can't brag on our students enough. But Stillman, University of Alabama, Tuskegee, Alabama State, we're on a whole bunch of campuses. University of West Alabama, we do a lot of work on all these campuses. Yes, great question. Thank you.
My encounter with someone that probably had HIV was 40 plus years ago when my mother-in-law was there with cancer in Bethesda, and someone was quarantined there and I think died while my mother-in-law was there. So how far back did we really realize what HIV was? Was it how as America that we realized it was a problem?
Yeah, the first diagnoses were in 1981. And it took
That's
a few years
about that
to
time.
realize what this is. And then it took a few more years to realize it's not just hitting one group. Because if you'd have said in 1981 it was a disease that gay white men in bi-coastal metropolitan areas like New York or San Fran, that'd been fairly accurate in 1981. but it very quickly transitioned to the south, very quickly transitioned to black, which is what we observed, right? So it took us a while to acknowledge the disease, and then it took a while for us to acknowledge the impact on every.
So I got probably several questions. I won't ask all of them, but so genetically, how does this pass on to future generations if it's not handled at an early time?
Well, I mean, it's not genetic.
It's not genetic.
It's not genetic.
Okay.
So, any risk factors, high risk sex.
It's going to be for that
needles,
particular
yeah,
person.
yes. So it will be.
But
it's
the
in
environment,
the
but the environment though can keep it spreading.
The social environment.
Social environment,
Yes.
yes.
How about your nursing homes and comment?
Okay, so that's a great question, because there's these little blue pills, right? And so people are very sexually active to our ages at this point. And so we have started to see that. So not only do we have people living that long with HIV, some of them from the 80s, we have new,
Spread.
yeah, we have, well, you might get it when you're young and live with it, but we also have new diagnoses being made in older and older ages as well.
So I was kind of surprised about the number, 18,000 in Alabama, 250 new diagnoses just the first half of last year. And I know there was an exponential change in the treatment and everything in the 90s, but since then, after that kind of stabilized, what's the trend look like? Has it been going down? Has it been kind of flat since then?
I think that question hurts me because it's not as flat as you want it to be, right? And this is, I'm going to speak freely since I'm here, but we are never, ever, ever, ever promoting high risk. We're not. Okay? We're addressing a public health issue, right? We can either ignore it, watch it spread, or do something about it. That's what we're doing. But one of the reasons, really the main reason we started the PrEP clinic is sometimes people are going to do what they're going to do. We can give you the very best prevention outreach we can give you, and you can still walk out the door and do what you do. So if we have a medication we can put you on that will prevent you from transmitting and then ultimately spreading it, that's what we do. So we still see the numbers rise. Alabama does a really good job among the southern states, but that number is never dipping the way I wish it was. Great question, thank you.
Where's your major funding come from?
Another great question. And these are scary days. Okay? So one, you guys remember Ryan White from the 80s? He was a middle schooler, he was a hemophiliac. He got a blood transfusion, contracted HIV. Basically, got kicked out of middle school and became the face of HIV stigma. We have federal funding now that supports us serving individuals with HIV in poverty with all those services I mentioned earlier. So that's called Ryan White funding. That's federal funding. And then we have, if anybody's familiar with 340B, it allows us to purchase some of these medications at a discounted rate. The discount comes to us, and then we have to pour that back into community services. We also write a ton of grants. We have fundraisers, but we're not fundraiser centric, thankfully. But we are unbelievably diverse as we do financially, as much as we can be, because I've seen agencies put all their eggs in one basket. That's the best up dead water. So our biggest are the Ryan White 340B, but we have many, many pots that we're trying to access. Yes.
Yeah, 200 employees.
I do. It still feels weird for you to say that, but yes, we do.
Where are they based?
Starkville, Tuscaloosa. We have one person in Selma who does medical care, a ton in Montgomery, and then what, maybe 30 here in Selma? 45 in Dothan. So they're spread out all over the place.
Wow.
And I didn't mention this, but I keep talking about these rural counties and the challenges of folks getting to us. We also have some off-site clinics. And so we might be using another clinic's brick and mortar space or county health department spaces where we'll have a skeleton crew that goes there so that folks can much more easily get somewhere close to their home. Because we could have folks live 100 miles away from the clinic, right? So we have our brick and mortar spaces and our main locations, but we also make sure that we're venturing out, making it as easy for our patients.
Where is your location here?
It is Honeysuckle Road, 1800 block. It's a little strip, and we have 3 suites, 1800 Honeysuckle Road. Okay.
Next week, this program is Rick Pates, Alabama Agricultural Commissioner. I will be, Mr. Alan Richards will handle the program next week. My kids are both on vacation from college, so we're headed to the beach and doing family time. And if you can help Alan out, I know he's gonna do a great job next week. I will be back. I know that's scary, but I will be back the following week. And that following week is the next board meeting, so board members, next, March the 17th. And if we can stand for our 4-way test. Of the things we think, say, and do, is it the truth?
Is it fair to all concerned? Will it be of goodwill and friendships?
Will it be beneficial to all concerned? Will it be fun to all concerned?